In this video, I will be demonstrating insertion of a peripheral IV catheter. Pardon the angle, it's just what I'm using to hold up my phone. So, in order to do this, you're going to need your gloves, which is your PPE we have right here. And down below you see we have our alcohol prep, we have our lock, our saline lock, we have transparent dressing, 10 milliliter flush of normal saline solution or 0.9% sodium chloride, our IV needle and catheter, and a roll of tape. Now, before I get started, I want to go ahead and set myself up for success and put all of my equipment together. So, first thing we're going to do is we're going to open our transparent dressing. And when we peel that off, again, that should be transparent, and that's going to go directly over the catheter site, the insertion site, to hold the IV in place. Next, we have our restricting band or tourniquet. This is what we're going to use on the patient's arm. Then we have our normal saline flush. And then we have our extension set. So, go ahead and open this, and typically there is a little tear mark right there where you can just open that up, make it easy. And that's what this looks like. Next thing we're going to do is, since this is sterile, since it just came out of the package, this will be sterile as well when we take the cap off. Maintaining sterility of these tips, we're just going to go ahead and screw those together. Secure that in place. That's your lower lock. Now, we want to go ahead and prime this. So what we're going to do is we're going to remove the air from the barrel of the syringe and push the air up through the lock to the very end. So sometimes a little trick when I do this is I just aspirate, I pull back a little bit of air into the syringe. So I'm just pulling back to break the seal in the barrel of the syringe, and then we push all that air up and out. And what we can do is, if you see those bubbles in there, you can kind of just push all those out. It might make a little bit of a mess, but that's okay. As long as you have the air out. I'm going to go ahead and correct that. If the air bubble does go to the other side of the syringe, that's okay. Just keep an eye on that as well. But I'm just going to invert this at eye level for just 1 second. Okay, so we have our lock and syringe prepped. A little bit of a mess, but we won't mind that. Next thing we're going to do, we have our supplies put aside. So what we're going to do is we're just going to, as usual, verify our order. We're going to verify the patient's name and date of birth, have them verify that as well. So those are our two identifiers. We have our patient here, here's our hand, and then we're going to start an IV in the patient's ACF. Now, as you see on the fake arm here, there's nice forearm veins we can start. You want to go someplace without a bifurcation, which is a split. And if you insert the catheter at a split, that'll typically cause some type of either infiltration, or you won't get a good backflow of blood. So, actually, instead of doing an ACF, I'll just go with the forearm. So, first thing I want to do is put on my PPE. Next, I'm going to take my restricting band, and I'm going to explain the procedure to the patient, just let them know that doctor ordered that we're going to start an IV, and that we're going to go ahead and continue with that procedure as long as we have their permission. And then we're going to go ahead. Now, For the purpose of this video, I'll go a little bit over the AC, which we're not supposed to ever go at the crease of their arm with a tourniquet. But since I'm doing a forearm, I can actually scoot down a little bit. It's not good practice to go over the AC with a tourniquet. Typically you want to go 2 inches above that site or 2 inches below, especially if you're starting a forearm vein. So what we're doing right now is okay. In order to do this, you're just going to cross this over, and you're going to pull one end of the tourniquet taut, and you can hold it like that. Okay, so one end is taut. Take the other end, pull that taut as well. I like to go ahead and pinch the two together right here, and then tuck this just underneath so that it catches. That way when we release the restricting band, it'll just release as soon as we pull this top tab. Now, again, as you can see, this patient has beautiful veins, which is the fake arm. Not all of our patients are going to be like that. Once we've gone ahead and selected our site, typically it's going to be what you feel, not what you see. You can see something like an area of skin like this right here where it doesn't have anything, but if you go ahead and you palpate and you feel a protruding vein and it's not pulsating, typically, and as long as it's straight, that'll be a good vein to insert your IV catheter. Next thing we're going to do is we're going to take our alcohol prep, and then in a circular motion, start at the center, and we're just going to push all those germs away from the insertion site. Doesn't have to be for a particular amount of time, but as long as we have that there and clean. So again, we have our lock, we have our tape, transparent dressing, and our IV catheter. So now that we have our injection site that we have picked out, we're going to pick the appropriate size IV. In this case, we have an 18 gauge catheter. We pick that based on the size of the patient's vein. Typically, you don't want to have this on the patient longer than 60 seconds. So I'm just going to leave that on for educational purposes. So again, we have this 18 gauge IV. With experience and time, you can basically use your judgment on the size IV catheter that you're going to use. Typically, smaller patients, pediatric patients, anywhere 22 to 24 gauge IV. Adults, typical 18 to 20. Situations like acute emergencies, you'll use anywhere from 14 to 18 gauge IVs. So obviously, the lower the number, the larger the gauge of the needle. Next thing we're going to do, we're going to take our needle, and then to remove this, we're going to pull this away from us and take the cap off. Always pull away, don't ever hesitate and push back because you will poke yourself. What we're going to do is we're going to insert the needle with the bevel of the needle up, facing up. I don't know if you can see that. The quality of my camera is not that great, but as you can see there's an opening of the needle, and that is going to go, make sure the opening is, which is called the bevel, is going to be facing up. Next, what I'm going to do is I'm going to take my non-dominant hand and I'm going to pull the skin taut. I'm going to take my dominant hand holding the needle with my thumb and middle finger, and I'm going to pull the skin taut, pick my injection site, again, bevel facing up. You can go at a 45-degree angle and then scoop down to almost parallel, or you can go at about a 30-degree angle, insert directly, and still kind of scoop in just to get your needle into the vein. Now, once you do this, you're going to have a backflow of blood in this chamber here, which we don't have with an artificial arm, but you will see the dark crimson color flow through this, and once you do that, it just verifies that you have placement. Now, you want to look around this site, make sure you don't have any extra, swelling or any bruising. Once you have your needle and catheter inserted and in place, you want to go ahead and advance the catheter with your index finger, push the catheter in, and it should glide in without resistance. Once you have the catheter in fully, you're going to take the back hub of the needle and you're going to retract that. Okay, and once you do that, you're going to go ahead and finally release the tourniquet as we showed. I'll get my hand out of the way here so you can see, and that should pop right off. Now, once this is in place, the needle is removed, the catheter is in place, this area remains clean. What you can do is you can occlude the vein up top here just to make sure above the sanitary site just to make sure that the blood doesn't come out from the catheter once you remove the hub of the needle. So with my middle finger, I'm going to occlude, index finger and thumb, I'm going to hold on to the catheter. I'll do this so you can see, and I'm just going to gently twist that off. From here, I'm going to take my dominant hand. This must remain on the end of the lock, because that has to remain sterile, because that is what is going into the patient. We do not want to cause an infection. I'm just going to go ahead and remove that from the cap, keeping that clean. That is going to be inserted into the catheter, and it should screw on like a lure lock. Once we have that there, we can go ahead, hold our IV catheter in place, aspirate by pulling back on the plunger and looking for blood return. You will see blood return in the lock here in the extension set. And then we're going to go ahead and we would just flush 2 to 3 mLs of the normal saline, and then we'll make sure that there is no resistance when we push this plunger, which means that with the blood return and no resistance means that the IV lock is secure, or the catheter is secured in place. Then we're going to go ahead and just remove this syringe, not letting go of our catheter. I'm going to untwist that, lay that off to the side. Next, we're going to take our transparent dressing. You can also call the commercial name as a tegaderm, and then we're going to peel this off. And that is the transparent dressing we were talking about. Kind of knock that out of the way. It's going to go directly over the catheter, covering that, keeping it clean. Next thing we're going to do is we're just going to remove the paper dressing around the transparent dressing, or the paper around the transparent dressing, and then that can stay in place. This looks like it was a little bit older, so this should all come off no problem, and then it'll just be clear as you see it there. Next thing we're going to do is we just want to make sure we secure our catheter in place. Sometimes depending on the patient, if they're confused, sometimes they may want to pull out their catheter or try and take it out. So just want to make sure that it's secured in place just with your 1-inch tape. Surgical tape typically works better than paper tape. It's a little stronger, not as sensitive on the skin, but it still helps hold it in place. What we like to do is we take the lure lock, place it almost parallel with the IV itself, or the catheter, and then we're going to take this and secure it across the base of the catheter, which is a little tricky here. And then we're going to go directly across, secure the hub in place. That way we have access when we go to administer our fluids, medications, and so on. What I like to do is, sometimes you have a loop here, which can sometimes catch on to things. You want to avoid causing any hooking, avoid causing that to become hooked on anything, bed rail, if the patient, is going to the bathroom. We just want to make sure that is secured in place as well. So I'll take a little less tape than that. And just secure that loop as well. That way we still have access to clamp off our IV. That way we don't have backflow from here into the extension set, which would then cause a clot. So again, we want to avoid that. So there's your IV catheter, and that is a video on IV catheter placement.